In this, we discuss the alarming resurgence of poliomyelitis in Afghanistan and Pakistan. Since the Global Polio Eradication Initiative began in 1988, polio cases have decreased by over 99%. Two wild poliovirus serotypes have been eradicated. However, type 1 remains endemic in these two countries. In 2024, Pakistan reported 70 cases of wild poliovirus type 1. Afghanistan recorded approximately 25 cases. This is increased compared to just 12 cases in 2023. The rise in cases coincides with the influence of militant groups in both countries. Anti-polio initiatives have faced severe disruption. The Tehreek-e-Taliban Pakistan has intensified attacks on vaccination teams. Misinformation about vaccinations is rampant, particularly in tribal areas. Some believe vaccination is a Western plot to sterilize Muslim children. Others think immunization is un-Islamic. Such misconceptions hinder vaccination efforts. The United States Central Intelligence Agency ran a fake vaccination program to locate Osama bin Laden. This has created lasting distrust towards vaccination efforts. Shakil Afridi, the Pakistani doctor involved, remains imprisoned for his actions. The Taliban has also restricted vaccination efforts. They banned house-to-house campaigns in September 2024. This decision was possibly influenced by fears of revealing their leaders' locations. Kandahar, a Taliban stronghold, now has the highest number of polio cases in Afghanistan. The Taliban prefers vaccination at mosques, which is less effective than house-to-house campaigns. Women's participation in vaccination teams has been crucial in reducing refusals. However, restrictions on women's public roles threaten this progress. Despite the challenges, there are lessons to learn from Nigeria. Until 2019, Nigeria was also a polio-endemic country. The country faced similar issues with anti-polio propaganda and militant threats. However, Nigeria successfully eradicated wild polio by engaging religious leaders. In Afghanistan and Pakistan, influential religious figures could play a vital role in promoting vaccination. A Pakistani official warned that polio could spread if vaccination efforts are not coordinated. The geographical proximity of these countries makes this a pressing concern. The COVID-19 pandemic brought into light that viruses do not respect borders. Complacency is not an option for Afghanistan and Pakistan. As winter approaches, both countries have a chance to enhance vaccination efforts. This could also improve bilateral cooperation amid strained relations. The expulsion of Afghan refugees from Pakistan in late 2023 worsened the situation. Many refugees settled in areas with high polio cases. Pakistan's National Emergency Action Plans for Polio Eradication emphasize cross-border coordination. Vaccination at border points and synchronized drives are part of these plans. Fresh vaccination campaigns launched in late October 2024 signify a willingness to cooperate. However, the lack of policies to protect polio workers remains concerning. The security situation in Pakistan poses challenge. Polio cases often emerge in conflict-prone areas. Balochistan, facing an ethno-nationalist insurgency, reported the highest number of cases. Pakistan must strengthen its law enforcement to protect vaccination teams. The Taliban, now in power, have a responsibility to promote vaccination. A massive outbreak could undermine their governance. Despite their repressive tactics, the Taliban are not immune to health crises. Thus, the resurgence of polio in Afghanistan and Pakistan is alarming. Urgent action is needed to address misinformation and enhance vaccination efforts. Collaborative initiatives between the two countries could be very important. The health of future generations depends on immediate and coordinated responses.